if you notice, we have a little bit different reports for our active cases. And unfortunately, with the numbers at this point in the pandemic, there's just so much inaccuracy when we have current active cases. So we're just seeing humongous cases of delays. In fact, I think there's like 50,000 cases that they haven't been able to get through yet. So there's just an incredible number that are not reported. And secondly, there's obviously some changes in the isolation and quarantine guidance. We talked about that last week. So there was isolation for 10 days, and then the CDC adopted new guidelines for 5 days of isolation, and then Minnesota Department of Health a few weeks later adopted that as well. So it's really kind of a challenge to talk about people that are contagious. So as you look at the numbers, you'll see there's a little more accuracy for the 9th through the 15th because of the delay in the cases like I talked about. So they're quite a bit behind, and even that may change. But the 394, so don't get too excited about that. That's very preliminary. That's up to date of what we know. But we know even by the end of today and tomorrow, that number is going to really increase. We're not seeing a decline in cases, so we don't want to become complacent and think that number is, that's where we're at. We're not at that number yet. That's just what we have. Minnesota as well. So the 9th through the 15th, you see 66,313 cases. And really the preliminary number again is a little over 8,900. So again, it's been so difficult to get with the surge in the cases. It's hard to get up to date on reporting. In Cass County, they report from the 8th through the 14th as 41 cases, and then the 15th through the 21, 47, 35 new cases. So they're still way up there as far as the peak goes in North Dakota as well. So 11,756, and then the new cases 15,819. So they're extremely high. We're still seeing that ramping up. So again, delay in the number of cases. So I wanted to explain that. Hopefully that makes sense. We have a new slide here too. So trying to get a little bit of the reinfection data. And again, this is what we have at this point. For Clay County, 473 reinfections. So that's if a reinfection is if they've tested positive for COVID-19 more than 90 days after a lab confirmed infection. So that's what we would count as a reinfection data. In Minnesota, there's 38,230 as of reported right now of reinfections. In North Dakota, there's 7,698. There was no numbers available for Cass County, so we were not able to get any numbers for that. Next slide is our Clay County cases per week. So we show this from August of 21 through the 15th. So there's 1,290 cases, as we talked about, that have been reported so far. And you can see, if you think about last week, we had 569. So you see how the number has really increased as we go even a few days out from the board meeting. So there really is a delay in the catch up. And the preliminary number again for the 16th through the 22nd is the gray slide, which is again just what we have at this point in time, 394. But again, preliminary numbers. So it's a challenge to keep up with the accuracy on that. Clay County cases per week. So we're starting from March of 2020, and you can see the at the beginning of the pandemic, and then the peaks that we experienced or waves. So are we in the fourth wave or the fifth wave? Hard to know. There's debate about that, but you can see the huge surge that highest we've seen throughout the whole pandemic was again what we're seeing now with cases. And total cases by age group. So this is what's been reported for Clay County since March of 2020. So you can see it's 16,152. The age group of the 20 to 24 is still at the highest, but we're seeing still consistent high numbers through for the younger ages through the 40 to 44. And remember at the beginning of the pandemic, it was the more senior population, but now we're seeing the younger age groups. Okay, and then I'll turn it over to Becky.
Good morning. So this is the updated graphic from the CDC for community level of transmission. I think it probably goes without saying that we're still in that high level throughout all of Minnesota and really throughout most of the country, seeing high level of community transmission. It says Clay County deaths due to COVID per week. We did unfortunately have another death reported, so we have a total of 115 throughout the pandemic that have died in Clay County of COVID.
Kathy, in regards to families that have suffered a loss because of COVID, how are we communicating any possible benefits? I know early on there'd been some talk about COVID dollars going to families that had a loss. Are we communicating that, or
No, we are not at this time.
I'm not suggesting that that is necessarily in your purview, but I just want to make sure that that information is readily available to families who may need it.
I'm not, Madam Chair, I'm not sure if Minnesota Department of Health is, we haven't really talked about that on our meetings as well, so I'm not sure what they're doing across the state for those families, but I can certainly ask the question.
Commissioner Campbell.
Yeah, I do believe that in terms of financial assistance that can be there for those families, I believe that the funeral homes are sharing that information with them as that happens. So I think there is a method for folks to understand what potential benefits there are or financial recouping there is for them.
Madam Chair and Commissioner Campbell, maybe that might be some things that I know Social Services works with as well, so.
So this is the graph of COVID admissions for Clay County residents per week. This is new admissions per week. So we are again seeing kind of a concerning increase in hospital admissions. So the week before last, we had 13 admissions, and already for last week, there was 17 new admissions to the hospital. So to me, that is a concerning number because we know that 17 is a preliminary number, and as the data catches up, it probably is actually higher than that. So this is something that we'll be, watching pretty carefully over the next several days.
Just to follow up on that data, it seems as though there's been a large spike in available beds. I think it's probably important since residents will be accessing that. That's likely because there's been capacity limits raised at those hospitals, not necessarily because there's not as many individuals in those beds. Is that correct? Yes. Thank you.
And Madam Chair, just a quick aside, I did reach out to the CMOs of Sanford and Essentia and requested, meetings to talk about specifics because we've just been unable to get that information. So they agreed. We're meeting on Friday. So
Great.
We'll get more information from Sanford and Essentia and Fargo directly. So that'll be great.
That's good news.
And then this is the hospital capacity information that we have for local healthcare systems. So at the time of this report, there was a total of 7 staffed adult ICU beds available and 4 staffed pediatric ICU beds available. Statewide, there was 16 adult ICU beds available and 4 pediatric beds, all in Fargo. This is the North Dakota hospitalization data. So hospitalizations for COVID are up a little bit compared to last week. So there's 164 currently hospitalized due to COVID. Last week was 139. So we have seen a little bit of an increase, although not an increase in the number that are admitted to the ICU. So that remains the same at 20. Pediatric admissions, there's currently 6 that are hospitalized. And then again, the graph on the right just breaks down hospital admissions due to COVID by age throughout the whole pandemic.
All right.
And this is the vaccine breakthrough report, again, side by side for the numbers that we had last week compared to this week. So you can see we have seen a little bit of an increase in the breakthrough percentages, so it's at 6.923%. Breakthrough hospitalizations at 0.2%, breakthrough deaths at 0.039%. Again, continuing to see very, very strong protection against severe illness and death among those that are fully vaccinated.
I think as someone who also gets the information weekly, it's important to say that while we might be seeing breakthrough cases, the increase in breakthrough cases, those breakthrough hospitalizations and deaths really haven't fluctuated much. I mean, even from Delta and now Omicron, it is very consistently at that lower half of a percentage. And I think that's important for the public to know as well. No, not half a percentage, half of 100%. That it is quite low, so that's important.
And then this is a new graphic that I included this week because I thought it was a really good visual. This is published by the Minnesota Department of Health. And so it just shows a comparison over time for COVID-related deaths, comparing those that are fully vaccinated versus those that are not. And you can see that as time goes on, these lines, there's a huge gap in them. They're separated. So the blue line is those that are not fully vaccinated. The green line is those that are. So just again, getting the message out there that almost all of the deaths that we're seeing are among those that are not vaccinated. And then Jamie will talk about the vaccine data.
Good morning. Thank you, Becky. Okay, so looking at the statewide vaccine data as of 1/19 for the age of 5 and over, almost 69% of the Minnesota residents 5 and over are fully vaccinated. And then over 1.9 million have had their booster or their third dose so far. And then Clay County vaccine data is likely underreported, but we are looking at 59% of those 5 and over that are fully vaccinated, and then 64.5 that have had at least one dose, based on what MDH is posting. And
Any questions on the vaccine data? All right, thanks.
okay, and then looking at Clay County vaccine, 19,059 doses have been administered by Clay County Public Health alone. And then last week, we had just 78 doses at our clinic in the Family Service Center. And then if we want to flip to the breakdown of those vaccines. So for the week of, or last Thursday, basically, we had 6 first doses, 6 second doses, 48 third doses, and then you'll see the pediatric breakdown of the 5 through 11. So our second doses are starting to come in, so 12 first doses and 6 of the second doses. And then to the next slide, we have another clinic planned for this week on Thursday in the Family Service Center ITV room. The clinic will be from 10 to 2 for 12 and over, Pfizer for second and booster doses for 12 and over, and then also offering Moderna first and second doses for anyone 18 and over for their booster. And then from 3 to 5, 5 and over, we have the Pfizer first and second doses for the 5 to 11-year-olds, and then also offering Pfizer first, second, and booster doses for anyone 12 and over. And then the phone number, if you need any help for our hotline, is 218-299-7204. And as of the end of the day yesterday, we had just 20 people registered, so lots of spots are open. And again, I want to point out that anytime someone comes in asking for a flu shot at the same time, we will provide that as well.
Great info. Any board questions? Commissioner Keeley.
I really appreciate you guys coming in and adding some context behind the data that you're presenting. I pulled out last week's packet, and one thing that struck me when you were talking about the data lag and how, for example, this week our preliminary number for cases per week was 394. So that makes it look like it's dropping way down. So then I looked at last week what your preliminary number was, and it was 569. That jumped up to 1,290 in that time. So it's frustrating because it's really hard to make decisions looking at current data when the data's not current. So I think it's important for the public to know if they look at this online or watch this presentation, that that number very likely is going to jump way up. I mean, last week's number doubled, more than doubled.
Yep.
Yeah.
Yep. Thank you. That's actually correct. We know that we're still in the pandemic. We're still in the pandemic. Hopefully we'll see next few weeks. We just don't know that yet.
Do you have any further questions? All right, any other questions from the board? Commissioner Campbell?
I too want to thank you for the new information that you've included in our packets. It's helpful. I just want to just talk about this reinfection data for a minute. So the number, Becky, that you show here is 473 cases that we know of in Clay County that have been reinfected. And I understand there's a 90-day, it's after 90 days, so for example, the last 3 months, that data wouldn't be available for anybody who had been infected during the last 90 days, is that correct? Because they wouldn't be counted under the...
Right, I mean, not necessarily. So if someone had, for instance, tested positive a year ago and they wound up testing positive within the last 3 months again, they could be part of that number.
Yeah.
There-
But typically,
There's a lag, yes.
typically, somebody can still test positive 90 days after they have gotten the virus, right?
We do see that occasionally, especially with a PCR test, not as much with the rapid antigen tests. But for some people, they will continue to test positive for weeks just because there's some lingering viral RNA to pick up, yes.
Again, I try to, out of all this bad news, I try to get something good out of it when I can.
Yes.
And the fact of the matter is if I look at the 473 compared to the 16,152 cases, we're at a reinfection rate of 2.9%. And again, that isn't real accurate because that 90-day piece that's in there, but the fact of the matter is taking that 90-day deal out of there, that number would probably be higher.
Correct.
That 2.9 would go up higher. And again, this isn't talking about vaccine.
Right, yeah, this is not breakthrough
Yeah,
reinfection.
yeah. So I'm trying to still find where the good and the vaccines are, and I think there's likelihood, the percentages of reinfection for somebody who had COVID once like I did, but then was vaccinated and boosted, that percentage level of getting again really drops.
Yes, I would say you have very good immunity.
I'm trying to find some good in this and some encouragement for people who want to, just like that, that chart is just really, that's really something. This right here. I mean,
Yes, very good visual.
Really.
that speaks volumes right there. Thank you.
Madam Chair?
Yes.
We also have the data from the testing site.
Yes,
so
I wanted to
take a
talk
look at
about
that.
both.
Yeah. So for the week of January 9th, there were a number of tests, 2,540 tests performed, and a positivity rate of 20.31%. And last week, the positivity rate was at 25.81%. And then we just have the rapid tests that were done through the week of January 2nd, so 256 of those tests were performed. So a lot less of the rapid tests are being done. And that's what we have for the data.
Thank you. Question in regards to availability. Are you aware of the amount of rapid tests that site has on hand weekly? We're not, okay. And the reason I ask is I've heard several times that some folks had gone for rapid tests and they weren't there. So I'm trying to make sure I understand the whole picture as I see the data, which I appreciate.
Madam Chair, I did go to the website to register as well, and you can't choose whether or not you want a rapid or a PCR test, and so
Okay.
it doesn't tell you whether it's available that way either.
All right. So continuing maybe along that vein, we, as we've stated, sent a letter to the governor's office to really ask for increased availability. As that story has maybe gotten out, we've been hearing more stories from larger employers in regards to how problematic an 11 a.m. start is, specifically if employees can't go into work until after they've had that, in a time when we have a shortage of substitutes or fill-ins, that's really becoming a problem. And yesterday, both Mayor Carlson and I really worked a lot with Kathy to bring into the fold even more so Representative Keeler, Representative Markwart, and Senator Eakin to advocate for that, because the response to our letter really was what we're hearing is sufficient. There's not a desire to increase testing days, hours, and said that it really does work cohesively with the North Dakota site. Unfortunately, that's not true because they're not testing our Minnesota residents. And I think it's even, to get a broader scope of that look, is that it's not just Moorhead residents that are testing. And there are employees in Fergus Falls and Detroit Lakes that are trying to get tested at Moorhead as well. And an 11 to 6 is just not working. So we will continue to advocate for additional time. And I've also heard some horror stories of people having an appointment but still having to wait in the same line as people that don't have appointments. And so the question is, what's the purpose of scheduling? I did talk to the Minnesota Department of Health rep that's in Fergus Falls. She relayed information to me to contact this Chris at the state, who really does the scheduling and works with the contractor. And I think that from my perspective, the answer is not good enough. We do need increased availability. Telling people to just order a test online is not an appropriate response, because there are limitations to people getting online to schedule a test. That's assuming that people have readily available access to internet or phones or whatever. So this board will continue to advocate for flexibility, understanding the importance. With that, I will also say that last Friday, Clay County Public Health was the superstar in the room. I received a phone call that Senator Hoeven was coming to town because he needed to have a large meeting at the Diversion Authority to talk about a financing stream, had gone to the North Dakota site and was unable to test because of a lack of appointment, and had gone to our vault site, and walking up to the door, Senator Hoeven saw that we were closed. A quick call to Clay County Public Health, and Cheryl and Josh met the challenge, delivered a rapid test to Senator Hoeven in Fargo to make sure that that was done before his test. And I know that allowed a lot, or required a lot of flexibility on our part. Kathy, thanks to your team. That just goes to the same story that we've heard about your team throughout this entire time, that you'll go above and beyond to make sure and do whatever it takes to meet the needs of the public. So thank you.
Thanks for asking. We're happy to do it. Glad we can meet that need. So,
Any questions or comments from the board?
I just have one.
Commissioner Campbell.
Looking at the test page here, and I see that it has a breakdown of total saliva tests versus the rapid tests, and I'm kind of drawn to the rapid tests, and it's showing number of tests for the week of January 2nd was 256, and it shows nothing after that. Why is there such a lag in that reporting? You'd think a rapid test would be something that'd be fast and available. So we're actually showing nothing, no availability at all since week of January 2nd.
yeah, Madam Chair and Commissioner Campbell, I don't know. I'll reach out to the testing site folks and see if they can give me an answer why there is no number. I do know Madam Chair, that they did say there was less availability for the rapid test, and I have also heard when citizens wanted to get a rapid test, they didn't have any. So I'm not sure about why there's a lack of rapid test supplies there. It seems unusual when we have a testing site in Fargo, North Dakota, and they don't seem to run out of rapid tests.
And that-
I've not heard that that's been an issue. But we don't have enough rapid tests on our site. So again, more questions we need to pose and continue to reach out to MDH and get some answers on that. We asked for some rapid tests kits also to see if we could just get some to hand out, and the answer was no to that. They could give us rapid tests and we could provide the testing, but that's not what we wanted to do. We wanted to provide tests to the citizens that couldn't get them ordered or couldn't get them. We wanted to have some availability in our community.
Yeah, I guess, and that goes to, what our board's been advocating for in terms of, as Commissioner Mosher pointed out, the hours available and all those types of things that are important to us. And it seems to me that for a lot of things that our citizens do right now, testing is critical and timely. And for us to be shorted on rapid testing, I think is a disgrace.
Absolutely.
The fact that we don't have that 2 years into this pandemic, obviously the testing came a little bit later, but still at this point in time, there should be those rapid tests, and we need to continue not only talking about the available hours. I overheard a couple people talking about maybe going on a cruise or something. I won't name names or anything like that, but it seems to me that there's probably and we could have a lot of citizens who might want to be doing things like that.
Right.
And a lot of those require tests in
Right.
order for you to go. I've had some friends who went to Winnipeg, and you had to have a test before you went there, and a test to get back. And for us to get onto our daily lives, this is going to be a critical component of it. And I thank you for your advocating for our citizens of Clay County. But I think we need to all send a strong voice to get those rapid tests. So thank you.
Well, I think just to carry on a little bit, and I know Commissioner Ebinger had a comment, but in the email from Minnesota Department of Health, it stated that people were able to get whatever they wanted and could accommodate up to 700 tests a day. And unfortunately, this is a classic example of maybe the contractor who has the vault contract site is not being truthful to the whole story of what we're seeing. You can look on social media or hear conversations of people going to Fargo, North Dakota residents, and getting results within 4 hours. There is a phone number. If it's a delay, you can call to get those. I'm hearing that people who go to the Moorhead site are not finding out for 4 to 6 days. And that's not Clay County's problem, but it is our problem.
Right.
Because that is the responsibility of the contractor to fulfill timely results. And we need to advocate harder for what is the bottleneck? What is it? Do they need more? Are they sending all of the tests to the new testing sites that it seems to I hear all the time, that they're adding new testing sites in the metro? I'm not quite sure what it is, but what is happening at the vault site is unacceptable. Commissioner Ebinger.
Kathy, do you know how many metro sites there are for testing?
Oh, I have that at my office. I don't have it with me. There's a number of them, but I can't give you, I'm sorry, don't have the number with me. I have it at my office.
Again, listening to the meetings at the state when they're broadcast, it is just galling to me that they say, well, we know it's hard in Ramsey and Hennepin County, but there's plenty of testing sites in the suburbs, and just drive over there and get them. And now the assumption is we can drive over to North Dakota and let them take care of our Minnesota citizens on the taxpayers of North Dakota's dole. And we have had cooperation across the river up to this point, but North Dakota has had to draw the line. We have worn out our welcome. And it's not just Moorhead, it's not just Clay County. It sounds like we're providing these services for a big chunk of this state. And it's outrageous that we are being marginalized like this. And if they're not getting accurate information from the vendor, and my experience at that testing site has been good. I'm not going to complain, but I haven't been there since, it's been 3 or 4 months. And, if they're getting overwhelmed, the vendor needs to pony up the information and the state needs to get us the resources we need. But, this board is fully behind our public health people, and we've got to get this information out. It's got to be something that the state responds to. And I appreciate that we got our representatives notified of the issue, and I hope it gets aired out. But we need to make sure that they understand we're in a position right now that if we're going to follow their own recommendations, and we're going to have people isolate and take steps to identify if they have COVID, then we need testing resources. And that's not getting on the internet and ordering a test. We've ordered rapid tests in my house, and it's been a week and a half. We're waiting. And it's great. We want to have a couple of them around in case one of us feels bad, so we can identify it and take the appropriate steps. But that doesn't come, with the click of a mouse. So I really appreciate the efforts you've made. Stay on top of it. We will support you, and let this board know what we can do to get this information out and to get our voices heard, because up to this point, they aren't being heard, and there's no way to sugarcoat it. And if they think running over to Fargo is the answer, as Commissioner Mojo described, it's not an answer when they have to come over here looking and find the door closed. So appreciate it.
And Madam Chair and Commissioner Ebinger, we appreciate the support. We appreciate all that you did in pushing this out to the governor and legislators, and we'll continue to push on our end as well, because it doesn't seem like we're getting acceptable answers. We're getting we feel like we're getting brushed off. So we'll continue to fight the fight as well.
Thank you. Any further questions from the board? Anything else COVID related? Thank you for your work, everyone.
Thank you.
Thanks for the report.
Thank you very much.